So I got the question, what are the common mistakes that people make who have mental health conditions? Well, the big mistake is just you have to get to the point where you basically admit that I have a problem. So what? And you know what? So what? When I say so what? So what? We all have problems. We all have issues. None of us have no stress in our life. So, but there's common mistakes people make are either ignoring advice and not taking medication when they should. Because why? Because they listen to their friends. They go to Dr. Google and get advice from Google, and they're not trained to, and everything looks scary, by the way, on Google, or because you see suicide warnings and this. I mean, there's all this nonsense that goes on because the government controls all the information and the FDA. So it's really hard to get to the truth if you try to go online. So you might want to just go to a doctor you trust and listen to the doctor and try to follow the doctor's advice is probably your best bet. So common mistakes people make are, like I said, avoiding taking things that would help them. That's one. Taking medications irregularly. So for example, like, I'm just going to take it when I feel stressed. And it's like, it's not that type of medication. Okay, that type is maybe Ativan, Xanax, when you take it as needed. But when people try to think of like an antidepressant or a mood stabilizer, I'll take it when I tell them that that's not how it works. You have to take it once a day, every day. Every day, even when I go, yeah, but if you take it every day, what I'm saying is that over the next week or two, you're going to see your anxiety level just go way down. And then so this is going to prevent things. So I talk a lot about with patients preventative versus reactive. So preventative, like let's get to the core of the problem. Let's treat the anxiety or the depression or whatever is causing you to not sleep well, to have anxiety attacks. Let's treat the underlying condition. Then all of a sudden, the anxiety starts coming down, the sleep starts improving, things start to fall into place. So I think that, like I said, understanding that medications are not the enemy. They're your friend. They're there to help. And if I find the right one or the right mixture, it'll dramatically change your life. But it's a mistake if you basically are stubborn to the point you were not going to listen to what a doctor who specializes like me says. Well, that's a mistake because again, what are you going to lose? You try it and see if it works. I mean, there's no other way to know. And if it doesn't work, at least you tried. But again, it's hard with some people to get past this because they don't see it as a medical problem. They see it as a psychological only. They say it's mental. It's all in my head, and all those things are true because they're talking about their brain, but they don't even realize that they're talking about their brain, and it's a vital organ, and things can go wrong with it. I mean, other organs of the body, things go wrong, and then you take blood pressure medication for blood pressure. You take a thyroid medication if your thyroid is low. You take a diabetes medication. You take a host of things, and people think, oh, that's okay. Why is it okay there? Because that's a real medical problem. That's not like that psych stuff. That's not like that mental health stuff. That's not real. And so these are some common misconceptions about medications, and that people people get afraid because they again listening to the wrong sources of the biggie and not listening to medical advice. And it's like, if they're going to come see me and pay me to give them advice, why not try what I advise, and it's shocking how many people won't. And I just saw someone recently, it's like, I recommended something like 3 different times and she said no, and she hasn't done it yet. And I kind of given up. I was like, well, I've kept trying, I've had no luck. And so, so I can only help her if she lets me help her. And if she's like, oh, this is good enough. I'm on this one thing and I'm good. I'm fine. Are you feeling great yet? No, but I'm good enough. Are you still sad? Yeah, but aren't we all sad? Are you still anxious? Yeah, but aren't we all anxious? So this is the kind of thing I'm talking about, is that it's extremely common to not understand the nature of this and the importance of treating it. Another common mistake is that people have in their mind, I only want to take these for a couple months, or I only want to take these for this short time. It's not really how these medications work. I mean, there are some rare people that can take things for a few months, 6 months, go off them, and they're fine. And that happens. But a lot of people that it's more genetic and long-standing, it's not the case. And the medications are important to keep the person in that stable. So a lot of people, the big mistake is trying to stop things too quickly. Or getting to that level, like, well, I'm feeling great. I don't understand why I need to take these anymore. I was like, well, maybe you're feeling good because you're taking them, and that's the reason you're feeling so good. No, I think it's not that. I think it's something. My life is better. The stress is better than it used to be, and I think I can go off them now. And that usually doesn't go well. And then they were upset, and they're like, well, why doesn't And I go, well, it's not all about what's going on in your life. It's the factors that you have no control over. And that's what's driving this, and it's not something you can help. And so these medications are really there to help you to do what your body is not naturally going to be doing on its own. And so sometimes when they understand that, they stay on it, they're stable, then they kind of get past that part, and they're like, okay, and they don't worry about it anymore, which is good. But yeah, another common mistake is just relying on benzos, like Xanax, Ativan, Valium, Klonopin. Is focusing on the Band-Aids and not treating the underlying condition. The problem with it is they're not really good for you. Maybe if you take it here and there, little here, little there for just situational things. But some people, they take it more and more, and they get addicted to them. And then they can't get off of them, and then they get trapped. Now, there are people that have severe anxiety disorders and I prescribe benzos, and there are some people who really, they really do well with benzos. But these are people that I've already tried probably balancing everything I can, but there are still people at the end of the day that benefit from them, and that's fine. But when someone is just relying and they look at that, that's all I want, and some people say it makes sense to me because if I feel anxious, I take it and I feel better. But then I feel worse, and I do it again, and I go again, and I do it again, and they keep doing it, and they're realizing that it's just a Band-Aid, and we have to get to the underlying condition to treat it, and that's where I get into with them is let's try to see if we can reduce the anxiety by putting you on something healthy that's not addictive, that's going to balance your chemistry, and it's going to lower your anxiety, and then when that works, then sometimes they get off the benzo, sometimes they reduce the dose quite a bit. So anyway, that's another common mistake people make. Listening to friends and family, going like internet I talked about with Google, listening to people who are not medical experts, but they just have opinions, and the old saying about opinions, everyone has one. But yeah, a lot of people get advice from people who shouldn't be giving advice, and they may mean well. Oh, yeah, but my sister's an RN. Okay, great, she's smart, but when's the last time she prescribed these medications? Oh, never. Oh, okay. Well, my brother's a PhD in okay, let's say he's a PhD in neuroscience. Great. He probably knows more about neuroscience than I do. That's his profession, and that's what he teaches. But does he prescribe medications? Oh, no, he doesn't. Oh, okay. So why would you take advice from someone who has no experience doing this? Or a pharmacist, or anyone who is smart or has a degree or whatever, but are they clinicians? Do they prescribe medications? Or if they do they prescribe these type of medications? Because even a lot of doctors just don't feel comfortable prescribing these medications, and I'm trying to change that. I hope to change that, but that's the reality out there. Is that a lot of people they have a hard time finding the help. So going to someone qualified, someone you trust, and go through with. And again, if you're not getting results, if you're getting into a second, third visit and you're not getting any better. Well, that's not a good sign. That's probably a sign that you might probably start to look elsewhere. Because if you're not, just like anything that you go to, if you're not happy at a grocery store, you'll go somewhere else. If you're not happy with your hair salon, you go somewhere else, or your nail place. So why would you stick with a doctor that's not giving you results? You shouldn't. because the results should be quicker, and they should be quick, and we should know within 1, 2, 3 visits at the most. If I can help somebody, I'll know within the first, second visit. Often the first, definitely by the second, third. More complex people with bipolar disorder and more difficult variations of things, that might be 4 to 6 visits to get them at a good place. But it shouldn't take, it shouldn't take years. It shouldn't take months and months and months. We should be seeing gradual treatment. If someone is doing this right, you should be gradual treatment each step of the way. So. Anyway, if you have any questions about any of these things, feel free to contact me. I return every question. Thanks.